All right. Well, good morning, everybody. It's lovely to be here with you today. My name is Bronwen Edwards. I'm the CEO of Roses in the Ocean, and I'd like to welcome you to this active community conversation circle. So our event today is the fifth in the series of a lived experience professional development program that we're delivering across this year and next, and really looking forward to today's conversation with these three amazing community members and ladies. But first of all, I'd like to just take the time to acknowledge the traditional owners of the lands on which we are all meeting today. So I'm here on the Sunshine Coast at the moment. It's the country of the Cubby Cubby and the Jinnabara people of the coastal regions and the hinterland areas of the Sunshine Coast. Our guests here are joining us from Kempsey and Alice Springs and Darwin. And of course, all of you are scattered right across the country. So can we acknowledge, please, the traditional owners of the lands on which we're all meeting and pay our respects to elders past, present and future. I'd also like to acknowledge people with a lived experience of suicide, to acknowledge all of you and the unique perspectives and insights that you bring to conversations, to suicide prevention, to your communities. All of it is so highly valued and valuable and so critical to continue the amazing changes that are going on across our country in suicide prevention. So thank you, and thank you for joining us. So today we are speaking with three inspirational community leaders. There are so many pathways to travel. When you have a lived experience of suicide, there are so many things that you can do. For some people, it's a real drive to actually get involved in suicide prevention. For others, it's not, and that's fine. Whatever people's individual journeys are, that's the right thing for them. But today we're specifically wanting to just shine a light on some of the incredible work that is going on at a real grassroots level in community. And these three women here have chosen different and yet equally powerful pathways. So we're going to talk today about, excuse me, about how it is that you can bring your lived experience to a community and actually start something yourself. How do you create something out of nothing, or out of a terribly tragic experience that you have had? Or others may choose to join with community organisations that are doing amazing work and to bring their particular strengths into that work. So what we're going to do today is it's structured, but it's not structured. It's a conversation circle. We call it that for a reason. So we will be just having a great conversation. But first of all, I'm going to ask each of these ladies to introduce themselves, give you a really high level view of who they are and what their role is and what the organisation is that they're working with. And then we'll go through a series of questions to sort of unpack a bit more of the fabulous work that they're doing. We will have time at the end for some questions for you. Questions and answers. So please jot down any questions you have for anybody throughout the course of this webinar, and we'll do our best to answer as many of those as we possibly can in the time that we have today. So could I, first of all, perhaps if I go to you, Lidia, I'd like to introduce Lidia Di Lembo. So Lydia's in Darwin, and I'll hand across to you, Lidia, to say hi and introduce yourself, please.
Hi, Bronwen, and good morning, everyone. Thanks for joining. I'm based in Darwin. I am a mum of 3 children, 2 boys and a girl. I lost my daughter to suicide in August 2017. And since then, I've been involved in setting up an organisation initially called Sabrina's Ride for Life, and it's now called Sabrina's Reach for Life. And our focus really is to reduce suicide in the community and reduce the tragedy that many families face by losing a loved one to suicide, by engendering compassion, instilling hope, and promote healing in our community, amongst other things. But in essence, that's really what our focus is.
Lovely, thanks, Lydia. Melissa, if I come across to you in Kempsey.
Hi, Bronwen, and hello everyone who's come along to hear us speak today. I'm the project coordinator for Kempsey Community Suicide Prevention, and we're part of a trial here for the lifespan model from Black Dog Institute. So my role really is to implement 7 different evidence-based strategies and make sure that those are community-led and community-owned. I've been in the role for almost 3 years now, and I do have my own lived experience of suicide, and I'm a big part of my community. So I think what I'll be focusing on today, though, is one of those strategies, which is the lived experience strategy.
Lovely, thanks, Melissa. And Laurencia in Alice Springs.
Hi, thanks, Bronwen, for organising this. And welcome everybody. I'm coming from Aranda country in Bantwa, Alice Springs. Currently, I am working as a suicide prevention project officer with the Mental Health Association of Central Australia. So I've been connected to this organisation since 2004, but I'm currently in a role that is in an organisation that has been running for about 30 years here in Alice and provides psychosocial support for people with mental health issues, and also has an arm that looks at health promotion activities and events and raising awareness in the community. But it's also, this organisation has had a role in suicide prevention since 2001. So I came on board a few years later, and I'll talk more about that later. But I also chair the Life Promotion Network. So that network has been in Alice Springs. It's a suicide prevention network. It's been running since, in different forms, but since the late 90s. And it's now part of the Wesley Life Force networks.
Lovely, thanks, Laurencia. And look, I might stay with you, Laurencia. What I'd really love to understand is how and why did you get started in your role? Like what was the catalyst to even getting involved in suicide prevention, and in particular in the work that you've been involved in Alice for so long?
Yep, it's a bit of a story, so I'll try to, I've actually got notes in front of me too, so.
Right, we've got some time. It's a nice length of time we've got to have a good chat.
So in the mid to late 1990s, there was a call to action in Alice Springs and across the Northern Territory based on an urgency to address the increasing numbers of youth suicides in particular that were occurring across the Northern Territory. At the same time, suicide deaths were occurring amongst Aboriginal and Torres Strait Islanders, and it was causing great concern. The first reported suicide of an Aboriginal and Torres Strait Islander in the Northern Territory was in 1981. So from the 80s onwards, and especially through the 90s and 2000s, the numbers really started to increase. So there were 3 organisations in Alice Springs that got together to try to think about what could be done at that time. Tungunjira Council, that's still running, it was set up in the 1970s to support town camps in Alice. Some leadership from that organisation. Another organisation was ASIAS, Alice Springs Youth Services, Youth Accommodation Support Services, and mental health teams. So mental health, we're in the not-for-profit sector, and government mental health workers got together and they piloted a program called the Life Promotion Program. So they got some money from the Northern Territory government in 1998. It was based on a model that was operating in Yarrabah in North Queensland, and anyone who's followed Ernest Hunter's work in North Queensland, Ernest Hunter was writing a lot of really important papers at the time. He's a psychiatrist, and people were reading his work, and they invited him to the Northern Territory to talk about the Life Promotion Program that was operating near Cairns. So the Northern Territory government then funded 2 workers to be based in Alice Springs and 2 workers to be based in Darwin at that time. So that was the late 90s. The Mental Health Association of Central Australia took over the management of that program in 2001. So they took it out of the government department, and they've held a lead role in suicide prevention ever since. So I arrived in 2004 from Melbourne. So I had recently, at that time, I'd completed a diploma in loss and grief counselling after having worked as a secondary education teacher, and I'd worked in community development roles in local government in Melbourne. So when I arrived in Alice, I just had always wanted to work in the Northern Territory. I'd always wanted to work alongside Aboriginal people. Anyway, so I felt that this was the place to be. I wasn't seeking a role in mental health or suicide prevention, but I did want to do something meaningful. And I wanted a role that would allow me to engage with Aboriginal and Torres Strait Islander people. And I wanted to travel out to remote communities outside of Alice as well. So when I saw the position advertised, it really matched my skills in community development. And I was working originally, when I took the role, I was working alongside an Aboriginal co-worker as well. And I guess the focus of that program at the time, it had some key areas of focus. One was to provide a local interagency response to suicide when a death occurred, that we were involved in responding. We were delivering training in Assist. So Assist was already being rolled out across Australia and it was popular in the Northern Territory. And I became an Assist trainer. And then we also had heard from some people with lived experience in Alice Springs, non-Indigenous women who had at that time lost, 3 of them had lost their husbands to suicide in Alice Springs. And I set up a suicide bereavement support group backed by my organisation. And those women drove an awareness day for World Suicide Prevention Day. So we started doing that day back in 2006. And then the other aspect of this role was to engage with Aboriginal and Torres Strait Islander people in suicide prevention and develop new resources. And that led down a whole other area of work that developed into a training tool called Suicide Story that very much took over a lot of my time in this role. And we also developed new resources like the Little Red Threat book that's just been republished. That was another piece of work we did back then. But we could clearly see that there was, you know, working with Aboriginal people needed new ways of thinking, and we had to really listen to what they could tell us about ways to provide support. So as far as my lived experience, it's interesting. I never say that I identify as having a lived experience of suicide, but I did come from a region of Melbourne where a number of suicides occurred, and it wasn't until later, and when the Royal Commission into Abuse within the Catholic Church, I identified that a lot of those deaths were associated with a pedophile priest that was in a parish where I went to school. So I was surrounded by friends, family members who lost young men in their families to suicide. So yeah, thanks.
Thanks, Laurencia. That's such a great, it's really great to look back and be able to connect the dots of how that has evolved in Alice and to today, and we'll hear more about the work that you're doing. So thank you so much for that. Melissa, you know, what was it that brought you into this space, and you know, why did you get started in the role? Why is this the right role for you?
Okay, so I guess a little bit of background about how the role actually came to be in Kempsey. So going back to about 2016, the Primary Health Network had identified various areas on the north coast of New South Wales where the community had concerns around various factors, including family violence and alcohol and other drugs, and suicide prevention was one of those. So they held a community meeting, and people from the community could turn up and have some discussion around those things. On that night, there was a committee that formed for suicide prevention. And that committee is made up of some amazing community representatives and members. So they worked really hard over the next couple of years to try and secure some funding excuse me, to do some suicide prevention work here in Kempsey. So they managed to secure the trial, and my role is the coordinator for that trial. So when I found out that the role was there, this was in mid-2018, I just really felt that I had something to offer, being a person with lived experience, I was very unwell for many years with mental illness here in Kempsey, and I had attempted to take my own life. So I really had a very first-hand experience of what services were available, what services weren't available, and how that whole, I guess, system and the way that people see people who are struggling and suicide in general. I was right in the middle of that for quite a long time. So when I became better, I really worked hard to involve myself with organisations who had those same values and were focusing on those same things, and kind of worked my way up to the point of being ready to take on a role like this. So yeah, I guess the reason as well why I did get the role is exactly because of that lived experience, and because I do have that true connection to community and that understanding. There are many, many people who have similar experiences to mine, and experiences very different as well. So yeah, I guess what I came into this role to do was to really get that message across and make sure that all of those voices are heard, and that it really is from that grassroots level, working our way up to make that change in the services and in the wider community.
Yeah, thanks, Melissa. I mean, it really sounds, when you explain it like that, that not only were you bringing your own lived expertise to the table, but also feeling that you could really be a conduit for so many other voices in community to be heard.
Yeah, absolutely.
Yeah, thank you. So Lydia, you know, Sabrina's Ride for Life, now Sabrina's Reach for Life. Tell us a bit about the story. How did it start? You know, why are you involved, and why are you still involved?
Thanks, Bronwen. So yeah, as I said, I lost my beautiful 19-year-old daughter, Sabrina Josephine, in August 2017. My daughter was a pretty normal girl. We're a close-knit family, and we come from a cold community, so our background is Italian. And I have had very little contact or interaction or even understanding about people who suffer from mental illness, disorders, distress, let alone suicide. I mean, there'd been a few that I knew that had taken their life, but it didn't directly really impact me, or I didn't really understand. But obviously, you know, it's a tragic event, and certainly I felt a lot of warmth and compassion to those that I had heard had gone through what I've now gone through and still go through. So my daughter was a second-year law student on 2 scholarships, had been an A student pretty much most of her life, and really pushed herself to excel, not because we encouraged or you certainly supported her, but she yeah, just wanted to do well, and study was her thing. But yeah, she became unwell, and I've been a public servant for over 30 years, and I've been involved in community as a volunteer, and I thought I knew how to navigate the system. But little did I know, when we got help for my daughter, and I won't bore you with all the details, but, you know, there were certainly gaps in the system. You know, we reached out to the mental health service, who refused to properly assess her. We took her to GPs who really didn't have a good understanding, and of you know, how to deal with someone with anxiety and depression. And it came out at the coronial inquest that you know, through independent psychiatric reports and GP reports, that there were certainly a lot of failings in what happened with my daughter. Now look, at the end of the day, the result might have been the same, but what was difficult for us to come to terms with is that all the people we sought help from actually did their job and knew what they were doing. And we, you know, the coronial and validated that our sort of suspicions that really something wasn't quite right when we went and sought help, to the point where Sabrina lost hope, really, at the end of it all. After we lost our daughter, my husband and I were in such pain and shock and devastation, really, that it was my husband's idea to do something extreme. And we wanted to really tell our story to create awareness that this can happen to anyone, really. And not just my family, but as I said, we were involved in community for many years. And so many people were just so shocked because they knew my daughter, they knew us, and it really can just happen to anyone. So we embarked on a crazy initiative, and my husband decided to cycle from Adelaide to Darwin to raise money for the Black Dog Institute. But more importantly is to raise awareness about suicide, the stigma around mental illness. And we you know, got sponsors, and we trained. I wasn't going to ride, I was going to be more the marketing PR person, but because we had a couple of one person pull out from the ride, there were 4 riders, I decided I had to embark on that as well, just in case people got injured. And in the end, I'm the one that got injured and broke my arm, and ended up walking the rest of the way from Port Augusta. But we raised with the ride and other events $100,000, which we donated to the Black Dog Institute, because we at that point felt that, well, we wanted answers. How can this happen? What causes this? You know, so many questions. And so we thought research is the best thing, really, or one of the things that we needed to support, because we need to understand more. What's the evidence telling us about people who become unwell and take their life? So that's why we supported the Black Dog. And from the ride and everything around that, and so many people shared stories. I mean, I still remember around a campfire, someone who lost her brother at a young age, and the family didn't talk about it for a long time. And she said it's the first time she felt comfortable sharing her story. And then she cried uncontrollably for the rest of the night. And I just thought, wow, you know, people need to be given an opportunity to share their stories. So then when we came back, I decided to start a bereavement support group, because there were no support groups in Darwin, and we are still the only support group that's operating for those bereaved by suicide. And then with others who came forward because of the ride, and we had a lot of media coverage, they came out of the woodwork saying they wanted to help. So it was kind of, I was pushed along in a way to do something more than just the ride. And that's how Sabrina's Reach for Life germinated, because we wanted to do something meaningful to reach out into the community in you know, even a small way that would make a difference to ensure that, or to help reduce other families going through what we went through. So that's how it all started. And you know, since then I've been involved with a great bunch of people who are on my committee, organising things that that will hopefully trigger some systemic change, because my experience was I had contact with the system. The system failed my daughter, failed us. So what needs to happen to make sure that there's a advocacy happening, and there's a voice from those of lived experience, not just mine, because there are other people that are in my organisation that've got a lived experience. It's all voluntary, by the way. And what do we need to do to make some change? So that's why, I organised a couple of things, like, and Bronwen knows, because she was an inspiration to me, and I got her to come up to our World Suicide Prevention Day breakfast that we had in 2019. And yeah, we had over 130 people attend. I thought we'd probably get 20 or 30. And that generated a bit of a report we sent to government, and then people said, we want more of this, we want more conversations. And then this year we held a World Suicide Prevention Day forum, and Bronwen was also a speaker there by Zoom, amongst others. So it's basically, yeah, we're trying to provide support, you know, with people from lived experience, advocate for change, and with the passion of those that are around me, trying to just make a small difference in our community in the Territory.
Thanks, Lydia. And look, that's yeah, it's a fabulous story, and thank you for sharing that, because it's really useful for people to understand the background of how an initial idea can grow and snowball into something so much bigger. I'd love to just have a bit of an explore with all three of you now around what's been helpful to get to that next step. And I'm thinking about, who are the people that you needed to get around the table? Who are the people that you needed to influence? And you know, was there a particular opportunity that presented itself? You know, when you look back, you can connect the dots. You know, I certainly, with Roses in the Ocean, I can look back and I can really very clearly identify specific opportunities, doors that opened or doors that we pushed open, people that we met, you know, opportunities that become tipping points in the growth of an organisation. So, Laurencia, if we come back to you to start with, you know, were there key moments that you look back now and go, that was really pivotal in this happening, or, you know, that you had to influence certain people?
Yeah, so I think what was helpful, just to start with, I think for us, it was very helpful to have adequate resourcing from the start. Like, I didn't have to put a lot of energy into fundraising, or, you know, we had to really just prove with the government funding that we were receiving from the time that I started, and even before that, we could just focus on what was happening. You know, a lot of my time to begin with was looking at what's the research telling us, and going to the Suicide Prevention Australia conferences and staying up to date with research and hearing about projects that were happening across Australia was really helpful. And I also did some study through Griffith University with Jacinta Horgood back in 2006. I just wanted to learn about what was the theory behind suicide prevention, and that would help inform my practice in this work. So I think having a person employed with suicide prevention in the title was really helpful as well. You know, I had a remit for just this particular area of work. It was a specialised area. It wasn't just an add-on to a role in mental health or in AOD work, or and MACA, the organisation, really backed me to stay up to date with reports and research and everything that was happening in the field. So that allowed adequate time to do some consultation across the community. And talking about who were the key people that needed to come to the table, I think listening to Lydia, you know, having the clinical mental health team understand the role of community development and suicide prevention from a community-based level was really important. And fortunately, we've got a psychiatrist down here, Dr. Marcus Tabat, who has backed this project from the very beginning. He's been a referee for me for many years. And I remember the first time I had to do a talk at the Alice Springs Hospital, I was very nervous, talking to a lot of nurses and clinicians at the hospital about the life promotion program. And I remember someone asking me a question. They're questioning my, I made a comment about working with traditional healers. I had thought that it would be good if we understood what the traditional healers said about this issue because it was impacting on Aboriginal families. And Marcus was in the audience, and I just remember him saying that's a really important thing to do, to understand the Nuncaries from this region, because they are trying to heal their people. And anyway, that was a bit of a win for me. And he got onto the Life Promotion Network. It's a constant battle, though. There are always a turnover of staff. Keeping people, keeping up to date with the workers in Alice Springs is hard. There's been some people that have stayed here for as long as I have and longer, but a lot of people turn over. And just when you think you've got a bit of a win with someone in an organisation, they might leave or change positions and they no longer can sit on the network. I think we just had time to listen, learn, build on ideas, be creative, adapt to the local context. Another win was it was identified that we couldn't go to every remote community. We wanted to do some work with Aboriginal people. We wanted to better understand what was happening for those communities and families. So we picked Santa Teresa. It's 80 kilometres outside of Alice Springs. It was a Catholic mission. And I just kept going out there every 3 weeks. No one would talk to me. I had an Aboriginal worker with me. They helped to broker relationships. It's such a sensitive topic. It took time for people to want to talk about this subject. You know, people go out to communities with lots of fun activities, youth workers, and I always think the suicide prevention role was really tough because it's not, people don't greet you at the gate. Oh, great, Laurencia's here to talk to us about suicide. But we just sat quietly with some women at it's called the Healing Centre out in Santa Teresa. I had a fantastic worker who was really great at it's a bit of a skill, just knowing the appropriate ways to work in this context. And a woman she was an artist and she was a traditional healer. She told us a story about losing her brother to suicide. And then she told us that she would make a painting for us that she would present to us telling that story. And it was an absolute breakthrough for us because we realised that we weren't the experts in suicide prevention, that we weren't going out there to tell them all we knew about what was happening nationally. These people had been losing family members and they had been thinking too about what the solutions are, how to notice warning signs, how to follow someone that they're worried for, how to bring them back to the fire, sit around the fire with the family, find out what's really going on for that person and how to keep watch of them 24 hours a day. So that woman who did that painting, Mia Mulladad, she gave us that painting and it became the logo for Suicide Story. So that developed into a 3-day workshop that's delivered by Aboriginal people across the territory. But it really was a moment where I really understood that people with lived experience, of course, they're trying to work out what's going on, what's missing, what do we need to be doing to try to save lives so that doesn't happen again. I'll just go back to my notes so I don't forget anything that I thought about telling you. The other thing about Alice Springs, it's really well placed to draw on expertise to address language and literacy issues in the development of resources training to suit Aboriginal and Torres Strait Islanders. And I know there are other places in Australia that also are really experts at this, but it can become, it just should be drawn on. We should be advising others about the work that we do here because it's, you know, we've had to really think hard, and a lot of the Aboriginal controlled organisations are doing this too, and in Darwin and the Kimberleys, North Queensland probably. But it's very frustrating when we see resources developed on the East Coast that don't suit the context of where we're working, even though they're being developed for Aboriginal people. So it's better to probably talk to us first. And the Life Promotion Network has been a really key, important mechanism. And the people that are around the table at that are from pretty much all the Aboriginal controlled organisations, all the mental health organisations, Headspace, all the drug and alcohol services, family violence, police, so emergency services. They don't always turn up to the meetings, but a lot of people have been aware of this network for a long time, and it is the channel for keeping people informed about what's happening across the territory. I don't know if everyone reads the stuff I send out, but I'm constantly trying to keep people up to date with suicide prevention, and I'm hoping, and when they come to the table, it's also a chance for us to partner with those organisations and then get some more funding. So organisations are often looking for ways to fund their projects, and if they want to focus on suicide prevention, we've got some expertise we can share with them about what's missing, what's already been tried before, what would be great to work on that hasn't been fully developed. So we do do a bit of that sort of work.
Fantastic. Thanks, Laurencia.
Yeah, so I guess I find a lot of great little projects developed out of really sitting at the table with a lot of other key people. Yeah.
Terrific. Melissa, how about you? So, you've talked about, this is a very specific project working on that lifespan systematic approach and what have you. Key people, key influences, what were some of those things that you very proactively went out in community and said, right, I really need these people here? Tell us a bit about that story.
Yeah, absolutely. So I guess we are a little bit different here in Kempsey, that our opportunity really started with the securing the funding for the trial. So then I guess my role really was in the beginning about how do we make sure that this is successful? How do we make sure this is what the community needs? So I guess the most important key to that success really has been that all of the work that we do for all of the different strategies really does start with the community. It truly is community-led. And what that does, what I've seen happen every day as I've been in this role, is that it really strengthens the community's investment and motivation into the success of what we're doing, because they are a part of it, and it is what they have decided, and it is their ideas and their vision. So as long as we make sure that that happens, then the community is invested, and we know that that's going to be successful. So we have really developed three very key networks for different strategies. One of them is the Lived Experience Network, obviously for the Lived Experience strategy, but we also have a collaboration for youth, the Schools Network for our young people strategy, and we have a local health professionals initiative for our workforce development, which is all around training and gatekeeper training and workforce skills. So with those three networks, who we have at the table is first and foremost always community. We always have those people with lived experience, and then we bring those professionals in and those representatives and those people who will listen and will act to make sure that change does happen and we can implement the actions that we need to. That's really what's been the most helpful part, I think, and what's led to the success of what we're doing, is having everybody from all of those different parts of community and different realms at the table at the same time. And then I guess another really unique opportunity that's come up specifically in our lived experience space is the collaboration that we have with our Kempsey TAFE campus. So they run the mental health first aid, the mental health peer work Cert 4 at Kempsey. So we have managed to make a collaboration with the TAFE where we have all of the students that are studying that course come in and do their work placement with Kempsey Community Suicide Prevention. This is the second year, so we're just at the tail end of that. And the great thing about that is that we have people with a lived experience of mental health or suicide that are then going to study and gaining those skills to do peer work. And then they're doing their work placement in this community-based role that is specifically around suicide prevention. It has been so successful in such a short time because now we're really seeing the creation and the relevance in those roles being created. Peer work is a very important part because they do have that lived experience. They have their own stories, and as we all do, our own things that we're passionate about. And so when we're looking at the community as a whole, then we're sure to have a peer worker, this person with the skills and the experience to then support and navigate and help advocate for the work that we're doing. So yeah, we've got the network working on all of the campaign and the training. We have Roses obviously coming in the beginning of next year to do some lived experience training with our local champions, and that will become the voice and the storytelling part of our lived experience network. And then we're also coupling that with these skilled representatives and workers in our community and creating that local connection, and then just encouraging, I guess, for organisations of many different kinds to really see the importance of having lived experience, in particular with suicide, because I'm sure that everyone that's listening and all of the panelists here can agree that it really is, you know, it's a very big thing for our communities. So we really need to address it specifically, and this is how we've managed to do that.
So Melissa, question for you, because you know, a lot of people will be really impressed and excited to hear about the collaboration that you have with the TAFE. That's not necessarily an easy thing to do. Now, obviously, a bit easier for the situation where you're in a trial site, you know, there's that backing there, you've got that organisation behind you. But was that a difficult arrangement? Did it take a long time to have that collaboration? How did you get those people on board? Because that's, you know, that's one of the hardest things, I think, when you're a community member and you're trying, you can see these opportunities, but how do you actually make it happen?
Yeah, so I guess, how do I explain it in a simple way? I think it's partly about having the right people, I guess, those people that are willing to listen and have that real connection. In our community here in Kempsey, really everybody has some connection to someone who has died by suicide, or someone who is living with suicidal thoughts, or someone who is struggling. So in that way, we do have many professionals all over our community who are very ready and willing to reach out and have those conversations. So there is that, but also at the time, and this is going back to the beginning of 2019, we had recently lost quite a few people in our community, and there was a lot of sorry business. So we had this class of students who were using their own lived experience in their study, and the TAFE at that time was really wanting some advice about how do they place those students then in individual work placements where the chances of them, you know, kind of possibly being triggered or being put in situations that are very real and critical, it was a real possibility. And then they're still learning. So I was approached with that question, and we started that conversation, and none of us knew in that room at that time what it would lead to, but just always looking for the steps to make it happen and never giving up. So that's how the conversation evolved. And how can we safely make sure that these students can use their lived experience in community for their work placement? And it just grew from there. Everybody took a risk in that first year. We didn't know what it was going to look like, how it was going to work, but we gave it a go, and it just so happened that it was exactly what the community needed, what the students needed, and it's worked really well. So now that's something that we can share with others, and share that with other organisations also in community. Obviously, the first year, it was very much just me putting my hand up. But this year, you know, there is more interest. There are other organisations saying to themselves, actually, maybe we could take on more than one student. Maybe it is easier to have a group of students, because really what you have is a little workforce that are very invested. They want to do their work placement hours. They're bringing their lived experience. They want to complete their course, and they have that real understanding of their own community. So it just worked really well. how did it come about? I think a little bit by chance and a little bit by really just, you know, having those honest conversations and not taking no for an answer.
Yeah, thanks, Melissa. You know, there's so many common themes. There's a perseverance absolutely necessary, but having the courage, like all of you have, having the courage to make bold decisions and take a chance, following your gut instinct, listening and really like listening and learning, and being prepared to either, you know, grab that opportunity when it comes, or even if there's just a crack in the door, it's about putting your foot into it and opening it up. And all of you are sort of talking about different examples of that. So Lydia, I know we touched on this a little bit when you spoke before, but was there anything else you'd like to add in terms of key points of influence, or what you did in order to determine who should be at the table to help Sabrina's ride move to Sabrina's reach, and because you've got a core group of people around you now. So can you just talk a little bit about, you know, how did you go about finding out who the right people were to surround yourself with?
Well, I certainly went knocking on a number of doors, and early on, just to really understand where to head to. I did talk to, you know, we got the support from people like the Administrator of the Northern Territory, who without hesitation supported us in our cause. We had the local radio host, 104.9, it'd be Katie Wolf. She's, you know, very well respected and regarded, and, you know, was keen to get us on radio often to talk about what we were doing, why we were doing it. So it's good to get people like that on side. So media. We also had people who'd covered the inquest, so from ABC and Channel 9. So I had that connection with people who, you know, were very supportive to do what they could to help highlight the issue of suicide in our community. And then really, like I said before, and door knocked on NT government, you know, to get a grant to set up the bereavement group, which was a one-off, and door knocking on the PHN as well, like what are you doing around suicide prevention, because they're the commissioning body, and everything's very slow, but, you know, even though it's a slow pace, change takes time. And, you know, I'm not the most patient person, so I think the slowness of the pace around suicide prevention in the Territory, and how so many people are doing some great work, but we're all working in silos. And so that's a bit of, you know, how do we make that more integrated? And I think that, as, you know, Melissa said, the community, people saying, oh no, you know, you're doing great work, you know, but can you focus a bit on this, and can you focus a bit on that? And so that people in the community who have their own stories to share, who want to get involved, is really, I think, what was keeps being the trigger for me to keep going, because sometimes you do get exhausted and not much energy, but, you know, I keep thinking about, why am I doing this? And really, the opportunity was created by my daughter, if I can say it that way. It's sadly that is the situation where we're in a club that we never thought we would belong to or be part of, but here we are. And so I bit like, you know, what Laurencia said, you know, I contacted Roses, and I contacted, you know, Standby, and being part of the lived experience group with Standby also gave me momentum to keep going and doing this, because there's so many sad stories, you know, but people want to make a difference. And so what small way can I have in that to just build the capacity for others to also make a difference? Yeah.
And so, Lydia, you know, along with opportunities and absolutely, you know, on everybody's path, we've all come up against barriers as well. I think most people who work in suicide prevention, volunteer in suicide prevention, and bring a lived experience to suicide prevention, a barrier presents an opportunity to find a way under it, over it, around it. It's something that slows you down but doesn't stop you. Can you talk about what some of the barriers have been for you, both personally and logistically? I mean, I know you've just touched on, which is why it's such a lovely segue. Thank you so much, Lydia. You've touched on the fact that it is exhausting. It is really exhausting and tiring, and it can be frustrating. So there's some of the personal barriers. Are there any others that you would see that, have been those times where you sit down and go, oh boy, and just another, how do we do this now? And then how have you navigated around it? Can you pick a couple out of your experience that have sort of presented challenges or barriers to you that you've had to work your way around, navigate through?
Yeah, look, I'll first say I know there's a lot of people working in this, sector like Laurencia who, are very committed to suicide prevention. But there's also people that I've come across that where you try to hold them accountable in a constructive way, because we need to try and work with everyone in this sector, paid and unpaid. But particularly those in paid roles, when you try and raise issues around what isn't happening and where the gaps are based on feedback from many in the community who have either had touch points with the system or lost a loved one and then they weren't supported, as a bereaved person. When you talk to people, sometimes you're talking like to deaf ears, because it's like, yes, but we are doing so much and we are doing this and we are doing that. But then you say, well, but it's not being effective because this is what people are saying. So what can you do to change? So I think it's the lack of people's understanding and true awareness of what people who suffer from mental illness or disorder or who are bereaved, what they're really going through is difficult. And that's our challenge, I think, as a group of people with lived experience. How do you crack that nut? And there's much more awareness and understanding now than 2 years ago, I think, even here in Darwin and the Territory. But it is a very difficult one. And I think that will continue to be a challenge for a while. And the stuff that's happening nationally with the Productivity Commission report and Christine Morgan's report, I think that's going to help set the pathway to change nationally and locally. But when you talk to people on the ground, it still is difficult. And that's where I said, sometimes you do get a bit disheartened and exhausted. But what grounds me, I go back to what I said before, is why am I doing this? And I feel like I owe it to my daughter, and I feel like I owe it to other families who have lost a loved one like my daughter, who may not have the capability and need help to share their story or to knock on doors, about their situation. So, yeah, I think, trying to crack that nut, I think, is going to still be a challenge, because some people think that they're doing wonderfully well. But those of us in the Territory know that there's a lot. And suicide prevention here is just like the poor cousin to mental health. Not many understand, well, it's not just about mental health. There's all these other, factors that have an impact on people who might become suicidal. So, that's, where we need to get really smart about telling the story and creating that awareness so people get it. A lot of people don't get it.
Absolutely, Lydia. And as you say, you've cited those 2 recent reports that were handed down just last week. And the fact that Australia has a suicide prevention advisor to the Prime Minister now, the fact that there's a push for a national suicide prevention office, there is, I hear what you're saying, because nationally things are shifting so monumentally, and yet grassroots, we've still got a long way to go. There's patches of absolute brilliance and innovation happening, and you can see that it's coming, but we are all impatient because people are dying every day. Yeah, so I absolutely think, you know, we are. The report from Christine Morgan and the task force is the best I've ever read since my brother took his life 12 years ago. It's the one that holds the most promise that I've ever seen, because they've listened so well. But yes, I agree with you. There are going to be those barriers for some time while the Titanic shifts, I guess. Laurencia, can I come to you for, are there a couple of particular barriers that you've found in your work that you really have had to navigate your way through, and how have you gone about doing it?
Yes.
Yes, how do I choose?
Firstly, I'd like to say thanks, Bronwen, for getting into the year of government. I think they have listened, and I think you've had a very loud voice, which is fabulous for that report. So all those people with lived experience that feed through Roses, it's been great. I was just going back to the fact that the work can be really sad work, and when I was involved in responding to suicides in Central Australia, it was, I'd get very sad, very angry, frustrated at systemic failings in the mental health care. I'd often think, how did someone not notice that there was something going, wrong for this person? And I understand that some of them were totally out of the blue and very difficult to notice, but it can be quite, it's rewarding work, but it can be very unrewarding as well. Like I said, no one really gets excited about you coming to talk unless they've got a specific interest in this area of work. And there's a lot of gatekeepers in the Northern Territory, a lot of non-Indigenous people who stop you at the gate before you can even get to talk to young people or Aboriginal people in communities. And it's very frustrating because they think they're protecting these people out there who, this is such a sensitive topic, and they already have to deal with their complex lives, and there's so many family hassles and trauma that they're experiencing, and you're just another person that's going to talk about something very sad and hard. And that took a long time before Aboriginal people would start to recognise that I'm still sticking here. I've been here for nearly 16 years and I haven't stopped caring about the issue. And I know it's not just an Indigenous issue in the Territory. But that can be very frustrating when you want to get on the agenda for a meeting that's being held, and some of the big organisations that bring together all the traditional owners, and I want to say, let's put suicide on the agenda because this community's just lost 2 or 3 people. So yeah, that developing those relationships and getting the trust of the Aboriginal orgs and the communities takes a lot of time. There's still a lot of silencing and cultural stuff that goes on here that needs to be challenged and needs to be talked about, and it's very hard to go there as a non-Indigenous person. It's but I can see that there's some stuff that just needs to be shaken up a bit that will help to prevent suicides, and it's about silencing, it's about payback when people get punished after there's been a death, and even being able to grieve openly about a person who's died. And I'm trying at the moment we tried to set up a bereavement support group. No one's turned up in Alice Springs. And then I'm visiting organisations to say, what could our organisation, we've got some PHN funding, do to support people who are bereaved by suicide, even if it's not a formal, open support group, but just to, meet with some people in a yarning circle in a riverbed, get some resources that might help to open up a conversation. I just think there's a real need for that, and people quietly tell me that, but it's not easy for them to talk openly about it with their families or communities. The other barrier in the Territory, like Lydia was saying, we're not working well together in the Territory. There aren't that many of us working in the sector, and we probably speak to each other. And I went up to the forum that Lydia organised, which was fantastic. But we still have a big geography to cover in the Territory, small population, but really challenging geography. and climate. And so, you know, for some reason that means that we don't even meet face to face easily, and we try to do Zoom, and we try to, and like Lydia says, some of the organisations that are funded to do suicide prevention work aren't very transparent about what's not working, even if we raise it. And I feel like a broken record sometimes, that I would like to see some improvements in some of the national programs that are in the Northern Territory. Sometimes Alice Springs misses out. We get national organisations funded one position, and it's based in Darwin, and they've got to cover this whole region right to the borders of South Australia and Western Australia, and it's just not possible. So that's really frustrating, that we do need better resourcing around that sort of stuff, even though there's, you know, it's like, yep, we've done the territory, we've got that person in Darwin. And yeah, I just think that there are so many really important issues happening for, especially for Aboriginal people in the Northern Territory, lots of addressing the social determinants of health, like housing, poverty, food security, safety. Suicide prevention really hasn't had its day in the Northern Territory, not properly. It's, whilst I feel very grateful that this role's been funded for a long period of time, and we've had a position up in the Northern Territory government since about 2006, but other issues get priority. Alcohol and other drugs, there's lots of workers in that sector. Family violence, child protection, criminal justice, and we're trying to draw those workers to come on board with us on suicide prevention as well, because it's all related. But it is seen as a bit of an add-on to their roles, and they come to the network meetings. But I sometimes think it's a shame that it's taking a long time before suicide prevention really gets up, as seen as a priority issue for the Northern Territory as well. The Kimberleys gets a lot of attention, and it, you know, for the right reasons. There's some, you know, very high rates happening there, but we've had high rates in the Northern Territory for over 20 years as well. So yeah, those things can be a bit frustrating.
So much perseverance that's required. It's yeah, let's hope that some of that change does start coming. Melissa, for you in Kempsey, any, you know, if you singled out a couple of barriers, things that you've thought, right, how do I get through this? How do we get around this? What would they be?
I've got a couple written down. I did take some notes to keep me on track because I can talk a lot. So I think one of the barriers in our community, and I'm sure in other communities, is that when there is ongoing loss and grief within the wider community, everything is always urgent. So coming in, everything is important, everything is urgent. You want to do everything you can to fix every little thing, and that's just not, it's not manageable. So I think one of the barriers has really been about prioritising what we actually do first, and having to be patient. As Lydia said, you know, there is kind of this process that has to take place, and you have to start somewhere. And unfortunately, as one person, and if there was a bigger team, then obviously things would happen a little bit differently. But as one person, you've got to try and find where that focus is and then build from there. And that does take time. And just, I guess, not only professionally, but personally, that is a barrier, because you want to fix everything, and you want to fix everything now. And the community feels the same way. Another barrier, I guess, is the way that systems and support in general are set up to respond only in the crisis, respond when things are really serious, or sometimes when it is too late. It seems that it's taking a really long time, and it's really difficult to navigate how to put the focus on the prevention and on the intervention, and to have those conversations when things are okay and when things are going well. Everybody focuses on suicide when we've lost somebody, but we need to be focusing on that when everything seems to be going well. as well. And I think that's kind of been a little bit of a barrier. We're working towards that, normalising the language, having those conversations, and it kind of does really ease the way that people do see you as the suicide prevention face. And I agree with Laurencia, you know, in the beginning, coming into this role, people see you and they want to turn around and walk the other way because they know who you are and they know what you're there for. But it has been really about just having those good conversations, bringing people together and making it safe to talk about, so that there is some positivity in there and people can see what we are building towards. And that is that people do live, and people do live well. The other barrier that I've got here, just because my focus is kind of around the Lived Experience Network today, is that when you've got everybody in the community and you're focusing on whole of community, you have individuals that have their own stories and experiences, then you have families, then you have those community groups like the individual schools or the organisations, and it grows and grows until you're looking at the stories and the experiences of a whole community. How do you find what those true key messages are when you've got all of these stories that need to be shared? That's been really difficult to navigate, but we are doing really well with that. And I think that's where the Lived Experience Network and bringing all of those people together has really shown what it can do and where that success is. Because yes, we need to make sure that when we're sharing those messages, when we're telling the stories of our community, that everybody feels included. Our young people, our men, our women, our Aboriginal community, our schools, all of those people, right down to the individuals. So yeah, that's been quite tricky. It has been a little bit of a barrier, but there are always ways around that. And I think it just takes time and perseverance, which is, I've probably said that quite a few times today.
Yeah. Thanks, Melissa. So let me stay with you for a moment. So we're sitting at about 5 past at the moment. Really want to make sure we've got some time for questions. So can I just ask you, what's your hope, like what's next and what's your hope for 2021? So I'll go to you briefly, and then we'll go to Laurencia and Lydia, and then I'm going to come back around to all of you for your top tips. So hope, what's next for 2021, Melissa?
Okay, so we want to continue to grow our local peer workforce. That's something that's been really successful. We want to encourage for those new job opportunities to be in community and for those connections to continue. We want to push forward with our key messages and our campaigns within our Lived Experience Network. And I think the big thing overall for our suicide prevention work here is that we want to work towards really being able to hand over all of these community-led and community-owned networks and actions and approaches. I'm not in this role forever. The trial doesn't last forever. So we've always been working towards the point where the community then continues that on, and they have the skills and they have the confidence and awareness to make that sustainable and continue that on. So that's where we're at for 2020.
Fantastic. It's, yeah, talking sustainability, which is just so critical. Laurencia, for you, what's the hope and, you know, what's next for 2021?
Okay. I do hope that we can collaborate better across the Northern Territory. We certainly have been talking about it a lot this year. And, you know, I hope that a greater priority is given to the issue, and that national organisations draw on the body of knowledge that we already have here. I think that would be great if we are seen as people that have persisted and worked in this sector for a long time and form partnerships with us. I think also I'd like to see greater scope to shape the national models of postvention to suit a local context. And I know that there are some organisations out there that are funded to do this sort of work, but I really would love to see them work really closely with the local regions to develop the postvention support in a more appropriate way, and to just think outside the square about how people might want to be supported after suicide in the long term as well. We're hoping to do some work with the Alice Springs Hospital. There's some really good researchers there at the moment, and I'm sort of, having worked in the field for so long, I know you just got to grab the opportunity while they're there. And there's a woman that's a nursing background who's very interested to do some, hopefully, do some research with us around building the confidence of staff in the emergency departments of the hospital to support people when they walk through the door who are presenting with suicide risk. And we've sort of been working a bit with Bernard Leckning as well from Menzies School of Health Research, who's developed some guidelines for Darwin Hospital and Alice Springs Hospital. So I really would like to see those guidelines being implemented in the hospital setting. And we've also got this little great book called The Little Red Threat Book. And I'm really hoping that that book, if you haven't seen it, it's about suicide threats. We're hoping to make it more useful for remote communities and to work with young people. That's probably the group of people that I haven't talked about, but young people, it's very hard to get in to work with them because, as you all probably know, there's a lot of sensitivity around that too. But I think that there's so much scope to sit with those young people and start unpacking what's going on and what's this behaviour about, and let's talk about it with support from adults and family members in a careful way. But the other thing is communities of practice. I'd love to support people in suicide prevention working in remote locations like we are, or regional Australia. It'd be great to have a communities of practice like they were doing in Victoria across the 12 place-based trial sites. I worked down there for a little while and I thought it was such a great thing to do. And it's a very isolating job. Even if you get support from your organisation, you're still the specialist in suicide prevention, and it's great to be able to talk with other people across Australia or in other remote regions.
Absolutely, so valuable to be able to share, cross-pollinate, support each other. Yeah, really critical.
Yeah.
Lydia, for you, what's next for 2021? What's the hope for next year?
Well, we're in the final stages of our report as a result of the forum in September, and you know, some of the key things that came out of that I will make sure to push is a bit what Laurencia said. We need to get the people who are working in the sector together, you know, we've been talking about setting up a suicide prevention alliance where the sector can come together and, you know, share information, share what's happening in their community, and come up with strategies to, you know, advocate where we see that be it PHN or, you know, NT government or federal government needs to focus on. And I think the national agenda stuff is going to sort of help with that. So setting up some sort of suicide prevention alliance with a couple of other key organisations that are quite committed. We also want to advocate for government to set up a similar to what South Australia has, like a suicide prevention council, because there is no one at the moment that actually in a systemic structured way talks to government about suicide prevention. No one from the community really. So, you know, we need to change that because we're just talking about the power of lived experience, the power of community, but yet there's no architecture around how to make that happen or to facilitate that. So that's something we want to push for. My ultimate goal is to, at some stage, have a safe place for young people in the Territory. What is available now is pretty bad. There is a young person's place at the hospital, which is not great at all. In fact, from what I gather, I've not been there, but it actually makes people worse, not better. But there is no alternative. So there's a lot of support for it, but I just need to, you know, work out how to make that happen or get support for that. Yeah, keep doing what we're doing with Sabrina Street.
All three of you are going to be very busy next year. I'm going to ask you, now this is really hard. We've got a few questions that have been put into our question box. So 2 dot points and literally dot points. Tips for people who are wanting to get involved in community suicide prevention. What are your top two dot points? Over to you, Melissa.
My first point is you don't need to be an expert to make a difference. And my second point is always look for the opportunity. Volunteer, do the training, do the course. Just take the opportunity and advocate from there.
Fantastic. Thanks, Mel. Lydia?
Don't let suicide and your experience of suicide define you. Believe in yourself. Everyone has skills that they have, from their work or professional life or volunteering pre their suicide experience. So, draw on those skills to sort of help you make a difference in the area that you want to sort of focus on, if that's what you want to do. And the other is, because I overcommit myself, and I don't do this well, is self-care. So it's really important to, reflect, take time out when things get a bit tough, because then you're no good to anybody, including yourself. Yeah. So really take the time to take time out when things get a bit tough, and be kind to yourself, and then you can sort of regroup and then, keep going.
Lovely, good advice. Laurencia, your top 2 tips?
I think your first 6 months in any role needs to be about what's already going on the ground, because there's often an assumption there's nothing happening. And I think that sometimes I get a little bit annoyed when I find out someone's yelling out in the territory that nothing has been happening in suicide prevention. And the other would be to spend time looking at what the evidence is telling us that we should be doing, because there's been a lot of people working really hard on research, and read some of the key reports before, like ATSIS PEP, if you're working with Aboriginal Torres Strait Islanders, coming out of Pat Dudgeon's work is really important. The interim report to the Prime Minister, Black Dog Institute's done a white paper. I just think the current research is really important to be a good starting point. And then start talking to people.
Great, thank you so much. So just going to go to a few questions. We won't be able to answer them all, I don't think, but let's have a try. So the first one is to you, Laurencia. Laurencia mentioned the difficulty ordinary people and non-paid community members have in engaging in conversations around suicide. In your experience, what conditions have been helpful in getting people to open up, turn up, and have the courage to bring someone back to the fire?
I think showing your face. I guess I'll talk from experience of working in remote Aboriginal communities in Central Australia, but I think it's not okay just to walk in and expect that people are going to trust you enough to start opening up about such a sensitive and sad subject. So it's good to have a broker, have a person who can vouch for you, who's a local person, hopefully an Aboriginal person, and it's just important to just show your face and turn up to the place. I did this as well in a town camp. I was invited in with a lot of other mental health workers, and we just went there to have a barbecue. It might seem like, as a paid worker, that's not good use of your paid time, but it was really important just to go show your face, and eventually people would start to be curious about who you were, and someone would introduce you to the family, and slowly people would start to very quietly share a story. And I just think, I learned a lot about better ways to work with people here, and I'm certainly not an expert in it, but I just think that it's got to be a really slow process, and having people that can vouch for you is really important. And then eventually, like this year, we had World Suicide Prevention Day on the lawns of the Alice Springs Town Council, and these Aboriginal men from Congress stood up and spoke from their lived experience, and it was very powerful to see them up there. And I thought, we've come a long way from early days where I felt that it was very hard to penetrate that sort of region. It was very foreign to me too.
And thanks, Laurencia. And I think all of us have been witness to the power that sharing a lived experience story has in giving other people permission to start opening up as well. That in itself can be that initial step towards someone feeling like they can talk. You know, Laurencia, it's very similar but very different, of course. But just even in regional and rural areas, trying to connect with communities there, you do just have to go on roadshows. And you know, we've recently been out Central West Queensland. I completely lost track of how many burgers and sausages we cooked in a 5-day period, but we literally were just there. We were just there, and you need to be there often, and then you can start doing some work. But that's actually the most important work up front, is just being there and letting people know that you are absolutely interested and committed to being there for the long haul. So there's another question here. I might put this to you, Melissa, initially. What is the best way to find out about what is happening in suicide prevention in your community?
Ask. Put on those.
So, who do you suggest people ask?
I would suggest that you ask all of the different parts of community that should have involvement in that. So when we need to ask those questions, when we need to find out what is going on, we always, and it is just as simple sometimes as a barbecue, you put on a gathering, you make sure that there's food, you be really clear and simple about what that conversation is going to be about, and then you have those people turn up. That's how it works here in Kempsey. And then we just target all of those different groups. So we have a certain way of reaching out to community. We have a certain way of reaching out to our professionals. We have a certain way of reaching out to carers, if that's who we need to speak to, or to families, or to young people. It's all about really tailoring and putting that effort into all of those different parts of community and starting that conversation in a way that works for them. It's about knowing your community.
Thanks, Mel. And I guess also, because I'm not sure what perspective that question's come from, if it's somebody who's a community member just wanting to know what's going on as well, you know, your primary health networks or your local health district might be a good place to start, but also go seeking the grassroots organisations who really are feet in the dirt, working with people every day and know what's going on. And they lead.
Can I just say something too?
Yes, Lauren.
If you get onto the websites of your local suicide prevention funding, whether it's coming out of the government, NT government's website has all the listed projects that are funded, and the primary health network as well. And the other would be, if there's a trial site, find out what's happening in the trial sites, because they're happening all over Australia. But that's a good way to start. If they've got suicide prevention money, they should be doing suicide prevention, and you can then have a chat about what's that look like.
Fantastic, thank you. So Lydia, to you, a question: if you wanted to start a bereavement group, how can you find out about funding and where can you access resources?
So I would first go to your state or territory government to see if they've got any funds. They may not be suicide prevention funds specifically, but we do have that in the territory. There are other grants here called the Community Benefit Fund. So I think the funds are collected from the taxes on gambling. So most jurisdictions have that. I'd also look at the Federal Department of Health. There's a grants page where they release grants that people can apply for. The other way of getting money is, of course, through fundraising. You'd be surprised how many people, you know, if you present a good sort of, I don't want to call it a business plan, but, you know, what's the purpose of setting up a group and what do you want to achieve? Although suicide bereavement group is really sort of implicit. You might find people willing to support you with, you know, in-kind support, like a venue or food or some media. So, you know, you'd be surprised how many people would just chip in that way. And the other thing is do some research as to, because that's what I did. You know, I didn't know anything about how to set up a group. It's go and look for resources like Postvention Australia has some, New Zealand has some great tools I found around setting up support groups. And there are many, you know, that you can access online, and contact other support groups that have set up in other. That's what I did. I spoke to maybe 3 or 4. Just what did you do? How did you do it? What were the successes and failures? And how do you keep a group going? Because, you know, people will ebb and flow. You're not going to have a consistent attendance. So you need to be prepared for that. But even if one person turns up, it's still worth it because you've made a difference to that one person who needed help at that time.
Thanks, Lydia. That's great. Now, there's a question here with regards to looking for connection with organisations and individuals that support veterans and serving ADF personnel. Are we able, does anyone here have connections they can connect people with? Do you find that the civilian community differs greatly from defence? So I'll throw one into the mix. Certainly I'd be looking up Open Arms. So they are operating nationally with veterans. There's a very big veteran presence, and it was called Operation Compass up in Townsville. So I'd be trying to reach out into that area as well and connect with the people who are involved in that. Do the 3 of you have other suggestions that could be helpful? Melissa, you're nodding.
Yeah, I'm not exactly sure how much information they have up on the Black Dog Institute's website on their lifespan page, but I do know that there are some trial sites across Australia. So there are many different lifespan sites across Australia. Some of them have a specific target group. And I do know of at least one trial site that their target group actually was around veterans. So
that's the Townsville one.
Yeah, finding, okay, so it is Townsville. So the coordinator for that trial site, or if the trial is no longer running, then perhaps a representative at the PHN who would have that information would be a good way to go, because they would have been working then with the community, with that demographic, on those evidence-based strategies and what worked for them.
Thank you. Anything else to add, Laurencia or Lydia, with regards to veterans?
No, I was going to say the same thing. Just the Townsville site would be the best way to go.
Yeah.
It's not really an area that I know very well at all.
Definitely be able to connect further.
In Darwin, I know there's Bilroy House. Whether that's through Open Arms, I'm not sure, but they have regular get-togethers with veterans in Darwin.
Thanks, Lydia. Well, thank you all so much. Thank you for those questions. There's a couple more there that we just don't have time with, but I'll do my best to provide some answers. So look, just in summary, I've made a few notes throughout. I mean, you've all just spoken so much and so well for the last hour and a quarter. It's a difficult task to try and sum up, but some of the notes I made were in terms of it really speaks to grassroots support and focusing on the doing, being able to focus on what needs to happen as opposed to having to focus on fundraising would be incredibly helpful. So wherever you can garner some support for what you're wanting to do so that you can get on and do it is really important. A call from, I think, everyone here for, that real specialised role, that there is a dedicated person or persons team of people that are focusing on suicide prevention specifically, that understand that people become suicidal for all sorts of reasons. Some of them are coming from a mental illness underlying factor. Many are coming from lots of other underlying factors, social determinants that have nothing to do with mental illness. And we need to have people working from all different perspectives. Having value in other roles, so clinicians, other people in the sector that get it, that understand lived experience and value lived experience, having them on your side is incredibly helpful. They can open doors and open conversations with others that need to be enlightened around the value of lived experience. Really important to have great diversity around the table. Try and get everyone involved that you need involved, because that's how you get collective ownership. So put in the hard yards to bring people to the table, and keep inviting them. And ultimately, hopefully they keep turning up a bit more. Very strong message around listen, learn, and adapt to local community. You've all spoken about how important that is. Perseverance is another one that's coming on board. Needing doers. You know, you need to surround yourself by other people who can help share the work that needs to be done. You know, many of you have spoken about, it does take a toll. It can be tiring. It can be disheartening, but it's also incredibly rewarding. But if you can surround yourself by others who share the same passion, and you can do it together, that talks to sustainability itself. Key collaborations are critical. Be strategic. Find those people who can help spread the word, and can help support you in your venture to save lives. So may I please thank you from myself personally, from Roses in the Ocean. Thank you to all of you, Lidia, Laurencia, Melissa, thank you for your time. Thank you for everything that you do on a daily basis. And I really hope that for those of you who've tuned in today, that you have learned something, been inspired by these people, and please continue the great work that you're also doing out in your local communities. Take care of yourselves. It's been a big conversation. It's all been centered around suicide. Please go off now and have a nice cup of tea or a walk out in the sun or whatever it is. But take care of yourselves and have a lovely day, and we'll see you next time. Thank you.